Come in.
Hi, this is Steve.
Yes.
My name is Mike. I'm a nurse practitioner. I understand you're coming in to have a physical done?
Yes, I am.
Okay. Well, I just want to sort of get a little bit of information from you.
Okay.
First, your name. We'll just sort of go through this. Can I just call you? What do you want me to call you?
Chris is good, thank you.
Good. Well, like I said, my name is Mike. I'm a nurse practitioner student. What I'm going to be doing is just getting a real quick social history, a chief complaint, what's been going on with you, some of your past medical history, your family history, a little social history, some of your habits if you smoke. And I'd like to talk about your siblings,
Okay.
If you have any.
Sure.
So, your name is Christine.
Yes.
I'm just going to take some notes. Is that okay?
Sure, that'd be fine.
Christine. And how old are you?
49.
And do you have any allergies?
Penicillin.
What happens when you take that?
Hives.
Hives. Okay, so we won't be giving you any penicillin.
No.
So, when was your last physical exam?
About 2 years ago.
2 years? Okay, and what's been going on here?
Well, I've noticed over the past several months that I have some bloating and nausea after I eat, and I can't really figure out a pattern to it. I get nauseated, I get really bloated, and then every once in a while I'll also throw up with that.
Okay. And so that's been causing more problems. Been able to associate that with any foods or anything?
No.
What have you done to try and make it better?
Eating smaller meals, taking like Pepsid and Mylanta, and nothing seems to really make it any different.
Have you ever had an ulcer or anything like that?
Mm-mm.
Okay.
No.
So, just tell me a little bit about your past medical history. So, have you had all your childhood diseases?
I've had all my immunizations, all my childhood immunizations. I did have chicken pox when I was 4. And that's really the only like childhood disease that I had, no mumps or anything like that.
Do you have a surgical history, any surgeries?
I do. When I was 6, I had my tonsils out. When I was 19, I had a compound fracture of my left ulnar radius and dislocated elbow. And then, so they did ORIF of the left ulnar radius, and then the second surgery to repair the elbow. And then when I was 31, 32, I had my tooth pulled.
Okay, use the term ORIF. What do you do for a living?
I'm a nurse.
Oh, you're a nurse. Okay, well, like I said, if you have any questions, just holler at me, all right?
Okay.
So, let's see, I was also looking back when you filled out the sheet, you're also having some headaches. How are those going?
Oh yeah, golly, I have migraines, and I've had migraines ever. I know I had my first one when I was about 5 or 6 years old. I was diagnosed by a neurologist when I was 17. They are definitely associated with my period, and I still get them every time I have my period.
Okay, can you tell me how they present themselves?
It starts with pretty common migraine aura of light sensitivity and nausea, but I also have a tactile stimulation to my skin, especially wind. If breeze or wind blows against my skin, it just makes me crawl. Can't stand it.
And how's your vision during this? Do you see anything?
I don't have any visual disturbances. It's just a light sensitivity. And it's definitely on one side of my head, and it's like a pounding, throbbing stab that goes from the side of my head out through my eye most of the time.
Okay, is it always on the same side?
Yes,
Okay.
always.
What makes it better?
Ice, rest, dark, lay down, and Imitrex. I take Imitrex for that.
Okay.
Just need it.
So when you say that it starts with your menses,
Mm-hmm.
is it right at the tail end, or
Yeah, it's
just the
usually
day after?
it's usually closer to the end. Most of the time, it's a day after or so, but sometimes it's just at the end.
And how many of these headaches do you have?
I have them all the time whenever I have my period.
Do you have like one headache or 2 headaches?
They span over a couple days.
Okay.
So I'll take an Imitrex, it'll treat it, and then it'll wear off and it'll come back over a couple days.
All right. So, I think the things we're going to concentrate on is your some of the gastric problems that you have, and which may be right now just maybe more important right now since you're bloating and having some very uncomfortableness
Yes.
with that, and also the throwing out.
Yes.
Might concentrate on that a little bit more than just the headaches, but that's still an issue. We'll go on to investigate that. But I think those are the two things we're really going to work with.
Okay.
Can you tell me a little bit about your family history?
Sure.
Go ahead.
I guess my mom, both my parents are still alive. My mom has hypertension and diabetes, and my, and COPD and alcoholism. My dad has peripheral vascular disease, and really that's it for him. I don't think he has any type of other histories. Then I have, do you need to know any more than that?
Well, we'll just go back a little bit, maybe a couple more generations, just to have a good pedigree, what we call a pedigree, so we'll have a good understanding. Do you have any genetic diseases?
I do. My cousin was born with an extremely rare disease called epidermal myelisa bullosa, and she was born with the full disease, and she passed away when she was 21. They think my dad's brother, my uncle, and my dad's sister, my aunt, on the paternal side, have variations of that because they have retinal detachment, and they consider that a connective tissue disease. And the geneticist that has worked with the family thinks that maybe that's a form of it.
Okay, that's on your father's side.
That's right. That's on my father's side.
And what about on your mother's side?
Let's see. On my mom's side, her mother is still alive, but she has AFib, coronary artery disease, and some strokes. And then her father passed away from a stroke, and he had something called Schreidraker syndrome.
Okay. Well, have you seen? How many children do you have?
I have 3 children.
Have you ever seen a geneticist?
Just when I was younger, a geneticist evaluated everybody in our family, but they didn't do any testing on me myself.
So it says here, when you filled out your paperwork, that you are married?
Yes.
Okay. And you said you were a nurse?
Yes.
And do you drink?
Very rarely. Less than once a month.
Smoke?
No. Quit about 15 years ago.
Okay. Do you have any history of depression?
Probably mild depression when I went through divorce my second marriage, so nothing significant.
Okay. Well, let's see. I'm sorry. You have any brothers? You have brothers and sisters?
I do have brothers and sisters. I have 3 brothers. Brother number 1 just had a heart attack, so he has coronary artery disease, and that just happened.
Okay, how are you handling that?
Worried for him. He's young. He's younger than I am, so I'm the oldest out of all my siblings, so he's younger than I am, so he's 47. He's 47.
Okay.
47. And had quite a significant blockage. So, let's see. And then brother number 2 is perfectly healthy without any diagnosed issues. Brother number 3 is an alcoholic and has been through rehab several times and won't help himself.
How has all this affected your family with your mother and your brother?
My mom lives in an assisted living home, and she's pretty senile from her drinking. And then my brother is in and out of Salvation Army.
How old is your mother?
She's 70.
7. How old is your father?
And he is 70.
7 years. Okay. Do you have any other siblings?
I have a sister,
Mm-hmm.
and she does not have any diagnosed problems as well.
All right. Well, When was your last mammogram?
About a year ago.
Your last pap smear?
About a year ago.
So you do see
Yes.
GYN on the
A
side.
GYN.
Okay.
Yeah.
Well, what I'm going to do is I'm going to do an assessment on you, a head-to-toe physical assessment. So I'm going to go ahead and leave, and the tech will come in, and she will give you a gown and she will all set up for a physical exam. Okay, do you have any questions about what we want to do?
No.
Okay. If you, any point in time, have any questions, just let me know.
Okay.
Okay?
All right.
It's very nice meeting you. I'll be back in just a minute.
All right. Thank you.